New Disabled South presents.
Ask questions. If you don't understand something, you have to ask someone to help you. Don't let your pride get in the way of saying, I need help. Because everybody needs help.
Welcome to Texas, where Medicaid remains restrictive and dual eligibility can mean the difference between survival and crisis. Texas is a place where serious gaps in the healthcare system are as large as the state. Texas has over 300,000 people who remain on a waiting list for home and community-based services. For those who rely on their state for help, access to healthcare is shockingly limited, ranked among the lowest in the nation. In the Lone Star State, Diane has learned that navigating the system requires more than personal strength. It requires asking for help. At 73, Diane has lived in New York, California, Washington State, and now Texas. Each move meant learning new rules, new coverage, new ways to access care. Diane's medical needs are complex. She's had chronic illnesses since 1994, is in recovery, and managing seizures and high blood pressure, with blindness in one eye and deafness. But her greatest asset isn't her Medicare or Medicaid, it's her daughter. This is a story about what happens when you can't advocate for yourself, when going alone isn't feasible or possible, when pride becomes a barrier to survival, and when family becomes the bridge between bureaucracy and care. After decades on the streets across multiple states and a suicide attempt that nearly ended everything, Diane discovered that sometimes the most radical act is the simplest one: asking for help. I'm Stacey Abrams, and this is Dual, the true cost of care.
Dual, the true cost of care. I'd be lost.
Diane has been in Texas for 2 years now, but her healthcare journey spans decades and multiple states. At 73, she manages what she calls a lot of health issues.
I got a lot of health issues. I have seizures, high blood pressure. I'm blind in my left eye. I'm deaf in my left ear.
Her daughter, a nurse, made sure Diane's coverage was in order before each move. This kind of preparation matters because unlike Medicare, which is federal, Medicaid rules change from state to state.
My daughter's a nurse, so she made sure that each time we moved, she made sure that my Medicaid, Medicare, health things, everything was in order before she moved me. That way it was set up before I got here.
In New York, all Diane knew about was Medicare. She didn't understand they were different programs with different rules.
Medicare and Medicaid is two different things, but I didn't know that. I didn't know what was going on. I just thought I could use the Medicare anywhere I go, which I did. But each state has a different rules, so.
The level of involvement required is intense. As summer heat approaches, her family monitors for seizures that could be triggered by overheating. Her daughter coordinates everything from medications to medical appointments.
Because I didn't know what I was doing. My daughter said, no, Mom, let me take care of this myself. I'll be lost. If it wasn't for my daughter, I would be lost.
But this level of dependency creates its own emotional burden.
I have to do it at a slow pace, real slow. And I get aggravated. I get truly aggravated because sometimes I feel that sometimes I'm a little burden on her because she has to make sure that I'm okay before she goes to work.
At the senior center Diane attends, social workers help connect people to resources within their insurance networks. But her daughter has also warned her about a lot of predators who target seniors.
She said that's how they get seniors. That's how they get seniors to do certain, she don't tell me, she said, if you got a number on your thing and you don't know who it is, don't answer no questions.
The scammers know what Diane learned the hard way. The system is so complex that people will pay anyone who claims they can help you navigate it.
Everybody needs somebody.
Diane's story isn't just about aging or disability. It's about recovery, chronic illness, and a life that took her from addiction and the streets of New York. That work as a peer navigator came after years of surviving herself. She went to different hospitals in New York, educating people about her illnesses. However, her own life was complicated.
Even though I was a wife and a mother, I was a street person too. Things happened, Back then it was quick money, fast money, so you do what you had to do.
But she learned something that challenged her independence.
Nobody can take care of you better than you, but I find that's a lie, because everybody needs somebody. Everybody.
When Diane's daughter found out about her health diagnoses, she made a promise to take care of her. That meant flying from California to New York when Diane missed doctor's appointments.
She said, okay. She said, and you said, we'll just make sure that you take care of yourself. I said, I take the medication. A few times when she's in California, when I had a doctor's appointment, she used to fly to New York to make sure that everything was okay.
The coverage that made recovery possible followed her across state lines. In New York, her insurance covered detox and rehab programs that still check on her today.
My detox, my rehab, I still get calls from the program. Am I still doing okay?
But family coordination comes with guilt and a loss of independence.
They put everything on hold to make sure that I get to the doctor, to make sure that I get my meds. And sometimes I feel guilty about that because I don't want them to put their life on hold because of me.
Diane receives quarterly lab work covered by United Healthcare. Thousands of dollars marked, "This is not a bill." She knows that her care costs, even if she's not paying it directly.
I need it for medical reasons and whatnot. But if it wasn't for United Health, I wouldn't be able to afford something because I have, my labs cost a lot of money.
There's tension between what Diane thinks she can do and what her family allows.
My daughter, I tell her, I said, I'm old, I'm not dead, I can still do things. She said, yeah, but the doctor said you can't pick up nothing over 10 pounds. So I wait until they go to work or go to sleep and take the garbage out. That's how I do it. I have to do it sneaky for them not to.
The streets don't like me. Content warning. This section contains discussion of suicide.
The turning point came with an ultimatum. Diane's daughter told her, stop drinking or you can't see your grandchildren.
I remember a long time ago, my daughter gave me an ultimatum. She said, if you don't stop drinking, you're not gonna see your grandkids. So that changed the whole situation. I'd rather see my grandkids than drink. So that's what it was. And I haven't picked up nothing since.
Before that choice, Diane faced a debilitating crisis, the loss of her husband. After her husband passed away, Diane just gave up.
I went on a suicide binge. Everything that they told me not to do, I did. I just didn't care. But when it said grandkids, everything stopped. I want to be able to see them,
What saved her wasn't just the programs she accessed or the coverage she qualified for, although those resources definitely mattered. It was the grandchildren she wanted to enjoy and watch grow, the family that refused to give up on her.
I honestly feel if it wasn't for them, I don't think I would be here. I really don't. Because I like the streets, but the streets don't like me. I'll put it to you that way.
Now, at 73, managing multiple chronic conditions across state lines, Diane has learned something that took decades to accept.
I think it's kind of hard because they're trying to make sure I have my health, and sometimes I'm defiant about certain things, but they work with me.
Her message to others in similar situations is both profound and simple.
Ask questions. If you don't understand something, you have to ask someone to help you. Don't let your pride get in the way of saying, I need help. because everybody needs help. Whether you want to accept it or not, everybody needs help. And at our age, we need all the help we can get, whether it's from family, friend, whatever. It's an outsider, you just have to ask. Nothing comes to you, you don't ask for it.
Diane's journey through dual eligibility across 4 states reveals something crucial. The system assumes you have advocates. It assumes you have people who can research coverage options, coordinate care across state lines, and navigate the bureaucracy while you focus on staying alive. She moved from New York to California to Washington to Texas, each time learning new rules, new restrictions, new ways to access the same federal programs, care that followed her across state lines, recovery support that still reaches out years later, family coordination that turns medical crises into manageable challenges. This is the reality of dual eligibility for so many. Because the system is so poorly designed and meanly managed, people step in to fill the gaps that government is expected to service. Instead of leaders doing their jobs, daughters become the nurses. Social workers at senior centers go above and beyond. Families stubbornly refuse to let pride become a barrier to survival. Many, like Diane, have to rig their own system to survive, refusing to go it alone. Others, unfortunately, cannot, and are often left to fend for themselves despite Texas's broken promises. Texas is one of 10 states that has rejected Medicaid expansion. Instead of bringing in more resources, the state's leaders refuse federal funding. As a result, eligibility remains restricted, and the waiting list for survival grows. Diane's story reminds us that policy is personal. Her survival is an exception, not the rule. The quarterly lab bills her insurance covers, the seizure monitoring that keeps her safe, the coordination that maintains her recovery. None of it happens automatically. Diane spent years on the streets, decades managing her disabilities and illnesses, and a lifetime learning that sometimes the most radical act is the simplest one: asking for help.
Nothing comes to you, you don't ask for it.
Her words echo beyond healthcare, beyond dual eligibility, beyond Texas. In a system designed to exhaust and exclude, especially in a state like Texas, where adequate healthcare is so far out of reach for hundreds of thousands of people, asking for help becomes an act of resistance. Accepting support becomes a form of advocacy. For those who can't advocate for themselves, someone else must step in. And for those who have become advocates, the system becomes navigable. For those who don't, the consequences can be fatal. Diane's message is revolutionary. Don't let pride kill you. Ask for help, because everybody needs somebody. Join us next time as we continue our journey through the South, where the true cost of care isn't just measured in dollars, but in the relationships that make survival possible.
To learn more about Dual, the true cost of care, tell your dual eligibility story, or to get involved, visit dualcostofcare.com.